Hi, I am Vishnu Sharma. I am 20-year-old engineering student from Kadapa. October 29th, I had a bike accident and too many bad fractures, and I was immediately rushed to Kadapa Government Hospital. And the doctor over there said we need some experts to deal with this case, and he recommended Apollo Hospital Hyderabad and Dr Kaushik Reddy. We came here on November 1st, and I had surgery on November 3rd, and I was discharged on November 5th initially. And again, it was all going well. Unfortunately, I fall again at my home on December 5th. And we immediately called Dr. Kaushik, responded and arranged for emergency surgery on December 6th, which was Sunday. But doctor was so patient and came and he treated me. He felt bad about doing the surgery twice, and now I am doing absolutely well and able to do all my movements. And I sincerely thank Apollo Hospitals and Dr. Kaushik Reddy for giving me the second chance to be healthy and to be fit. Thank you.
Hello everyone, I'm Dr. Kaushik Reddy, consultant orthopedic surgeon working at Apollo Hospitals, Jubilee Hills, Hyderabad. Today we have Mr. Sai Vishnuvardhan Sharma, who's 20 years old, who's studying his engineering. So he had come to me 2.5 months back when he had accident, when he fell from a bike, and he had multiple fractures on both sides. On one side he had very bad wrist fracture with hand fractures, and on the other side hand he had a radius fracture and a humerus fracture. So he went to government hospital in Kadapa and other hospitals also in Kadapa, but he was rejected. Nobody was willing to do surgery for him, and they have shifted him to Apollo Hospitals, Jubilee Hills, from one of the doctors in Kadapa who has advised him to come here. And when he came here, we operated all the fractures in the same sitting, and he was doing extremely well, and he got back his movements. He went back to the college and all, and suddenly one day in the bathroom again he had fallen and he had a fracture to the humerus on the same side we had fixed it before. So this was a very complicated case where already there was a fracture, and it is only 1 month old, and he fractured on the same humerus side below the plate. So in that case, since it was a complex fracture we treated, we immediately, when he came here next day morning, we did the surgery for him, where we didn't remove that plate, and we put another long plate and fixed the fracture in good position, and the surgery went off very well, and he was very comfortable after the fracture, and he's doing extremely well. Now it is 1 month following this refracture fixation and 2.5 months following the previous fractures. We've got x-rays done for him today. The fractures are healing very well. He's completely become normal. He's going back to his college, he's writing, and he's very happy about his treatment. So from this case, what is important is whenever you have any kind of injuries, where you have multiple fractures, polytrauma with other head injuries or anything, the immediate treatment is very important in that cases. You should not delay the fractures, and immediate the first aid done, and go to the nearest hospital where they are able to treat these kind of complicated fractures, so that first surgery is always the best surgery. Thank you.